Right now, we are in the midst of a bit of a healthcare revolution, if you haven't noticed. Has anyone noticed? We are like busting out of our cocoons and we are understanding that we are meant for more. And we're also understanding, especially in America, that we are devolving to become more and more motherfucking sick. We got a lot of shit going on over here. And it doesn't appear to be like on the decline. What I want you guys to kind of tap into right now is, where do you see yourself on this like spectrum of the health revolution? Are you like on the more timid side where you're like, yeah, I still believe in conventional medicine? Not to say I don't believe in it. So I'm going to asterisk that and come back to that. I believe insurance should pay for everything, healthcare for all, and whatever it is. But are you on the more disruptive side where you're challenging the system and doing things differently and believing in more preventative root cause care, giving more, better, deeper care and wellness services to your patients? Where do you fall? Because there are two different ways and two different systems in America specifically of healing. One system is designed for maintenance and emergency, and another is designed for healing and transformation. Good and positive things can happen on both sides. We absolutely need our conventional medical system and everything for the world to run. I fully expect the hospital to be open when I need it to be, and for labor and delivery to be open when I needed it to be. What I'm talking about is for those that are looking for a more interpersonal connection with their healer, with their practitioner, with their guide. Know that they cannot get that in the current construct of American conventional medicine. That leaves us with insurance actually, in some instances, not working in favor of the consumer, where insurance is dictating not only how much the doctors make, but how much care they can give you. It doesn't seem quite fair. And on top of that, you still have deductibles and things to pay outside of your copay and outside of your monthly insurance premium, and still not getting like exactly what you need. And I struggle with this concept a lot because our family stopped using conventional insurance a while ago, probably like a year ago, where insurance for my family of 4 was costing me like $1,500 a month. And I still was paying cash to see the providers that could really help us. Because we see naturopaths and chiropractors, acupuncturists, integrative doctors. We see doctors that have programs and memberships, direct primary care physicians, things like that, right? Not only am I paying insurance into this like black hole that I likely will never use, at least within the calendar year, I also am still paying out of pocket for the services our family needs. That is a lot of people. That's a lot of consumers. I just did an episode on like the 40-year-old plus consumer really dictating marketing and consumer spending and everything right now. And this is according to Forbes. We are the ones that are like, yo, we're waking up to where our investment is going in every part of our lives. And a lot of us want to still like have that same body and attitude and breath and energy and je ne sais quoi that we had in our days of yore, in our 20s and 30s. We're okay with paying for deeper care. There's a separation here for practitioners who are in that cash-based wellness space, right? I have many of those clients here in Atlanta that are doing it and doing it well. They got hormone programs, weight loss programs, direct primary care. They are fucking crushing it. Why is that? It's because they are differentiating themselves among the competition. We know that insurance is becoming more and more of just a commodity, just a thing, right? We'll keep our catastrophic insurance, for labor and delivery and for, hospital visits and MRIs and things like that. But for when it comes to our day-to-day care, we are up in here trying to see the experts that really can like help us live longer, look younger, and be a fucking rock star. Direct primary care, concierge doctors, what are you doing to stand out? You got to niche down. It doesn't mean you can't see multiple types of people, but it means that you need to be super clear on who you serve, the type of entrepreneur, CEO that is ready to invest in their health. They know that they can come and see you. They can get all of their needs met. This is where they can feel seen. This is where they can have that 30 to 60 minute visit as opposed to that 15-minute check in, check out. This is where you get the personalization, where you do DNA DNA-based care, where you get to communicate with your doctor by text and by email. You get a response like an actual human, you know? This is where you're getting some consistency and some follow-up. This is where you're taking your GLP-1s and your weight loss drugs and shit, but you're actually being held accountable to changing your lifestyle and really learning how to eat and do all that cool stuff. This is where healthcare is separating from the old story to the new story. So for the practitioners that are just putting their toe in the pond and pivoting from an insurance-based model to a more concierge cash-based model, I want to make sure that you know that you have to own your niche. You got to own it. If it's going to be hormones for high-performing women over 40, own it. If it's going to be I am your care partner through every phase of life, own it. If you're going to be helping men get their groove back with testosterone and all that stuff, own that shit. Don't make people guess on who you are. Dial in that messaging. Don't just say what you do, say what you solve, how you help people transform, and show the experience. A lot of these doctors are now starting to look alike now. They're all starting to say the same thing, like, I can help you live your best life through wellness and stuff. Nah, go deeper. Go harder. Double click on what your audience wants to hear and wants to see in your messaging. Create an immersive experience. Tell them what it's like to have you as a provider, as a partner in your health. Why this membership is going to be worth so much more to you than the $1,400 pre-tax that you was spitting out to insurance that'll still never provide you even 20% of what I'm about to give you in this 60-minute deep dive about your life. I remember my first functional medicine visit, child. That thing was 90 minutes. She asked me how I was born, baby. Okay? How did I come out the womb? I was like, good God. I mean, she got in it. Asking me questions, having me clutch my pearls. Like, I ain't come up in here for all this to be asking me about my sex life and how I sleep and how much alcohol I drink. What do you want from me, right? I wasn't expecting that. Like, that's a real thing. Someone getting to know you and actually helping you navigate age and mental health and growth dynamics at work, right? So I want you guys to show the experience and, most importantly, social fucking proof. You have to show what you do. Patient testimonials. I need all of the snippets and the clips. I need it all right? I need to see the 5-star reviews, and I want you to create that demand. Have people applying to work with you, yeah? Have people applying for a discovery call. Sell them a consultation. Sell them a wellness experience. Sell them a deep dive into their life. It is more than insurance will ever provide. It is really easy to see the cost-benefit analysis there. It's really easy to position yourself. Yeah, that $1,500 that you was paying pre-tax, you only got to give me $299 a month and just say yes to yourself for a year. That's only like 4 visits with me. Everything else is going to be automated. You're going to get all of your supplementation, the meal guides, the portal check-ins. Maybe you have a monthly Q&A. Maybe you have a monthly way to interact with your patients. Maybe you're creating communities that you're planting seeds of healing, right? You're changing how generations view how their healthcare could be managed by their trusted practitioners. Catch the wave. Add in those cash-based services. We still need conventional medicine, y'all. Insurance still absolutely has its purpose. So this is not me knocking insurance, but this is me for those that are pivoting and the business owners that are trying to wake up and saying, you know what? I want to serve a population that wants to look deeper at their healthcare. I'm challenging you to do it. Get that niche nailed down, dial in the messaging, showcase the experience, show us the proof, and give us that product, that program, that membership that make it easy to say yes to you instead of saying yes to something else that doesn't serve me. Show up in your business differently in a way that'll make it really easy for that 40-plus-year-old consumer that's ready for longevity and biohacking and hormone balancing and weight management. Be ready for them, show up for them with that clear message, and go and get that money, right? Yeah, I had to end with that, right? Okay, y'all, so make sure you like, share, and subscribe to this podcast everywhere the podcasts are available, and follow me on Instagram at I am Lauren Powers. I'm super nutty over there and I have such a great time, right? All right, y'all, make it a powerful week. Go make some money. Go make some money. See y'all next week. Peace.